Everyone heals a little differently, and that absolutely is true. But it's also incomplete because the real question is what determines that difference? So here's the myth. You'll heal fine no matter what your weight. So surgical patients hear it all the time. Everyone heals a little differently, and that absolutely is true. But it's also incomplete because the real question is what determines that difference? And one of the biggest, yet most overlooked factors is obesity. Not because of the fat itself, but because of what that fat represents, which is metabolic dysfunction. So today we're cutting through the myth that healing is passive and showing how insulin, inflammation, and excess body fat all delay recovery. Welcome to episode 70 of the Obesity Project. My name is Dr. Mark Shankman. I'm an oral and maxillofacial surgeon that believes in treating the whole body, not just the mouth. Today, we're talking about why obesity wrecks healing and what you can do about it. So let's start with inflammation. Obesity is a pro-inflammatory state. So fat cells, especially visceral fat, release cytokines like TNF alpha, IL-6, CRP. These don't just float around, they impair healing. So TNF alpha, if you've not heard of these terms, I guess I should define them. TNF alpha is tumor necrosing factor. IL-6 is interleukin 6, and CRP is C-reactive protein. Now, these inflammatory mediators don't just float around, they impair healing. And in a 2013 study in wound repair and regeneration, they found that obese patients had significantly delayed wound closure and higher rates of dehiscence due to chronic low-grade inflammation. And this was determined by Pierpoint et al. Back in 2013. So let's go with a clinical example. So I've seen this after extraction cases. Two patients, very same procedure. One metabolically healthy, the other with obesity and prediabetes. So guess who had the swelling that lasted a week longer and signs of dry socket? Same surgery, different terrain. All right, so we're going to talk about impaired microcirculation and oxygenation now. So excess adipose tissue doesn't just sit there. It restricts capillary perfusion, does not allow the capillaries, the smallest blood vessels in the body that provide nutrition to our individual cells. It restricts the blood coming in and out and giving off the oxygen and nutrients to the cells they need and getting rid of the waste that they don't. So in obesity, microvascular function is compromised, which means that there's going to be less oxygen delivery to the tissues postoperatively. And in a 2016 paper in Microcirculation, they showed that obese individuals had impaired nitric oxide mediated vasodilation, which is expansion or opening of the blood vessels, resulting in tissue hypoxia or lack of oxygen and longer wound healing times. This was by Clifford et al. And if the surgical site doesn't get oxygen and doesn't get nutrients, you're not rebuilding tissue. You're just stalling. And in oral surgery, that shows up as prolonged bleeding, delayed socket closure, and higher risks of infection. And that's just oral surgery. So the healing process has essentially three phases. First is an inflammatory phase or inflammation. The second is a proliferative phase or proliferation. And the third is remodeling. So insulin resistance interferes with all three. It blunts macrophage response, which are white blood cells that kind of clean up viruses and bacteria and other toxins and other invaders to our body. Not only does it blunt the macrophage response, but it delays fibroblast activity, which slows down collagen formation since the fibroblasts are what create the collagen. There was a 2017 study by Singh et al. In Diabetes and Metabolic Syndrome that found that insulin resistance was independently associated with slower wound healing and higher rates of surgical site infection, even, here's the big one, even in non-diabetic patients. We all know diabetics heal more slowly, but they showed in insulin-resistant patients without type 2 diabetes that they had higher rates of surgical site infection and slower wound healing as well. So think of healing like a construction project. Insulin resistance is like sending the wrong blueprints, delaying your builders, and running out of material. You don't just build slower, you build worse. So, what can you do to heal better? This isn't just all doom and gloom. It's a wake up call and it's an invitation. If you want to improve healing before surgery, here's how. Lower your insulin through carbohydrate restriction and fasting. Reduce visceral fat, not just for looks, but for oxygen delivery. Support anti-inflammatory pathways, which is through nutrient-dense foods. And you want to prioritize protein, critical for tissue repair. Also, you want to get sunlight, walk post-operatively, and breathe through your nose, which all support healing. So, research in the Journal of Clinical Periodontology shows that even modest improvements in glycemic control significantly enhance post-op outcomes after periodontal surgery or gum surgery. So you don't need to be perfect. You need to be in motion, and you need to be in motion toward metabolic repair. So this has been episode 70 of the Obesity Project, why obesity wrecks healing and what you can do about it. So surgical outcomes aren't just about the skill of the provider. They're about the state of the patient. And obesity, absolutely more than a number, it's a signal. It tells us about inflammation. It tells us about insulin. And it tells us what we're up against before we even pick up the scalpel. So if you want better outcomes, start by fixing the terrain and not just treating the symptoms. And oh, don't forget, we're cutting through the myths, getting to the root here at the Obesity Project. So thank you so much for watching. Like, share, and comment. Hit that subscribe button. Hit that bell notification. Keep getting my videos. Share these videos with others who need to learn this information. And I appreciate your time, effort, and attention. I will see you in the next video. Take care.